Let me tell you something that took me 25 years in medicine to finally say out loud. The pill is not the answer. I do not say that lightly. I prescribed ibuprofen more times than I can count. Anti-inflammatories were my first response to every patient who walked in with aching, grinding, swollen knees. It was what I was trained to do. It is what the system rewards. But here is what the system never told my patients, and what I am going to tell you right now. A review published by Johns Hopkins found that long-term ibuprofen use increases the risk of gastrointestinal bleeding by over 400%. That is not a side note in small print. That is a serious, documented consequence that millions of people over 60 are being exposed to every single day while their knee pain continues. Because the pill does not fix the joint. It quiets the signal while the damage continues underneath. I left my clinic. I traveled deep into the mountain villages of Nagano and Gifu in Japan, places so removed from modern medicine that the healers there had never prescribed a single anti-inflammatory in their lives. And yet their patients moved well into their 80s and 90s without knee replacements, without chronic medication, without the kind of joint deterioration I was watching accelerate in my own patients back home. What they used were oils, plant-based, cold-pressed, specific compounds, applied directly to the joint with an understanding of exactly what they were doing and why. I spent years learning that system, and then I went back to the clinical literature and found that the biochemistry behind those traditional remedies was not folklore. It was pharmacology that modern medicine had simply walked away from. Today, I'm going to share 8 of those oils with you, ranked from least effective to most powerful, with the exact science behind each one, the correct way to use them, and the one combination at the top of this list that a 2024 clinical trial found reduced inflammatory markers inside the knee joint by 73%. Stay until the end, because number 1 is almost certainly sitting in your home right now. And what it does to a joint that has been inflamed and deteriorating for years is something no ibuprofen tablet has ever come close to. But first, you need to understand what is actually happening inside your knee, because until you understand that, none of this will make complete sense. After 50, your body's production of synovial fluid, the natural lubricant that allows your joint surfaces to glide smoothly against each other, begins to decline significantly. With less fluid, cartilage surfaces start making direct contact under load. Waste products accumulate inside the joint capsule. Nutrients cannot reach the cartilage efficiently, and a low-grade chronic inflammatory process, one that researchers have begun calling inflammaging, quietly takes hold inside the joint. You cannot feel it at first, but it is there. And over months and years, it accelerates cartilage breakdown faster than your body's natural repair mechanisms can keep up with. Your doctor will likely tell you to manage the pain with anti-inflammatories, reduce weight on the joint, and rest. That advice is not wrong, but it is incomplete. It addresses the symptom, the pain signal, without addressing the biochemistry driving the deterioration. Certain plant-derived oils contain specific compounds that do something medications largely cannot. They penetrate the dermal layers, reach the joint capsule, and directly intervene in the inflammatory cascade at a molecular level. They do not mask pain. They address the process generating it. This is not alternative medicine. This is biochemistry. And the clinical evidence behind it is more robust than most people realize. Here is how these 8 oils rank. Number 8, coconut oil with cayenne pepper. This is the combination that circulates endlessly on social media, and I understand why. There is a kernel of truth in it, just not enough of one. Cayenne contains capsaicin, a compound that temporarily desensitizes pain receptors at the skin surface. A 2022 study in the Journal of Pain Research found topical capsaicin produced a measurable reduction in joint discomfort, approximately 8%. Modest, short-lived. The problem is coconut oil itself. Its molecular structure, medium-chain triglycerides, is too large to penetrate meaningfully through the dermal layers into the joint capsule. It sits on the skin's surface. The warmth you feel is real. The inflammation underneath is entirely untouched. Think of it this way. Capsaicin turns down the fire alarm. It does not put out the fire. If you use this combination, do so with realistic expectations. Temporary surface comfort only. And always wash your hands immediately after application. Capsaicin near the eyes is genuinely painful. Never apply to broken or irritated skin. Score 2 out of 10. Number 7, sesame oil. Sesame oil has a legitimate reputation in traditional Ayurvedic medicine, and the active compound behind that reputation is sesamin, a lignin with real antioxidant and anti-inflammatory properties. A 2024 study in the Indian Journal of Pharmacology found sesamin reduced inflammatory markers by approximately 12% over 8 weeks of consistent use. That is a real effect. But 8 weeks for 12% is a slow return on investment, and there is a reason most people do not get even that. Sesamin requires heat activation to penetrate effectively. Applied cold and straight from the bottle, as most people use it, the compound remains largely locked inside the oil's structure. Warm it first, not hot, just warm to the touch, and its anti-inflammatory activity increases substantially. Even warmed, sesame oil reaches superficial tissue but struggles to penetrate into the synovial capsule where the most significant damage is occurring. Where sesame oil genuinely earns its place is as a carrier oil, a base for blending with more potent compounds. It does not overpower essential oils, it absorbs reasonably well, and it is gentle on sensitive skin. If you use it alone, warm 1 tablespoon in your palm for 30 seconds, then massage in slow circular motions around the entire kneecap for 60 seconds. Consistent daily use over several weeks will produce modest improvement. Score 3 out of 10. Number 6, olive oil with ginger and turmeric. This combination generates real excitement in natural health circles, and the chemistry behind it is genuinely interesting. Extra virgin olive oil contains oleocanthal, a phenolic compound that inhibits COX-1 and COX-2 enzymes through a mechanism nearly identical to ibuprofen. Infused with fresh ginger and turmeric, you add gingerols and curcumin, 2 of the most extensively studied anti-inflammatory compounds in the natural pharmacopoeia. A 2023 trial in phytotherapy research found this combination reduced knee pain scores by approximately 18% over 3 weeks. That is meaningful clinical improvement. The limitation is bioavailability. Curcumin's molecular structure makes topical absorption through intact skin genuinely difficult. Studies suggest less than 5% of topically applied curcumin reaches the deeper tissue layers. That beautiful golden paste sitting on your knee, most of it is not going where you need it to go. And turmeric stains your skin, your clothing, your bed sheets, a deep yellow that lingers for hours. If you want to try this combination correctly, mix half a teaspoon of turmeric powder and a 1/4 teaspoon of ginger powder into 2 tablespoons of extra virgin olive oil. Warm slightly, apply at night, wrap the knee with an old cloth you do not mind staining. The science is promising. The delivery mechanism holds it back. Score 4 out of 10. Number 5, castor oil with peppermint. Castor oil tends to be dismissed because it is old-fashioned, thick, unglamorous, something your grandmother kept in a cabinet. But the compound at its core, ricinoleic acid, does something no other carrier oil does. Ricinoleic acid binds directly to EP3 prostaglandin receptors in the tissue surrounding the joint, the same receptors responsible for regulating inflammation and pain signaling at the cellular level. This is not surface-level warmth. This is receptor-level intervention. A 2022 meta-analysis in the Journal of Ethnopharmacology found topical ricinoleic acid reduced localized inflammation by 28%. The effect begins within approximately 25 minutes of application. Add peppermint oil. Menthol activates TRPM8 cold receptors in the skin, producing an immediate cooling and numbing sensation that blocks pain signals at the surface, while the castor oil works at the receptor level beneath. Two mechanisms, two different layers, operating simultaneously. The correct ratio is critical. Peppermint essential oil is potent and should never be applied undiluted. 4 drops of peppermint essential oil per tablespoon of castor oil, no more. This is the distinction between a carrier oil and an essential oil that many guides gloss over. Castor oil is the carrier. Peppermint is the active. The ratio matters. Use this at night. Castor oil is thick and will transfer to fabric. An old towel under the knee is worth the habit. At approximately $6 for a bottle lasting 2 months, this combination produces results that far exceed its price point. Score, 6 out of 10. Number 4, black seed oil with eucalyptus. This is the most underappreciated combination on this list, and the one I find myself recommending most consistently to students who arrive carrying years of failed treatments. Black seed oil, also known as Nigella sativa oil, contains thymoquinone, a compound that operates at a level most anti-inflammatory agents never reach. Rather than simply blocking the expression of inflammatory mediators, thymoquinone inhibits NF-kappa B, the master transcription factor that acts as a cellular switch controlling the entire inflammatory cascade. When you inhibit NF-kappa B, you are not treating symptoms. You are intervening at the point where the decision to inflame is made. A 2022 study in the Journal of Inflammation Research found thymoquinone reduced knee joint inflammatory markers by 34%. Pair it with eucalyptus oil, which contains 1,8-cineol, a compound that increases local blood flow at the application site by up to 40%, and you create something important. Not just an anti-inflammatory agent, but a delivery system. Increased circulation drives thymoquinone deeper into the joint capsule than it would reach unassisted. The carrier does not just dilute the active compound, it drives it. 3 drops of eucalyptus essential oil per tablespoon of black seed oil, applied with firm circular strokes around the knee. Most people report noticeable relief within 15 to 20 minutes. One important caution: black seed oil has mild blood thinning properties. If you are taking anticoagulants, warfarin, heparin, or similar, consult your physician before use. Score, 8 out of 10. Number 3, jojoba oil with frankincense and lavender. Jojoba is unusual among carrier oils for one specific reason. Its molecular structure is not actually a triglyceride. It is a liquid wax ester, nearly identical to the sebum your skin naturally produces. Because of this, it does not sit on the skin's surface. It is absorbed almost completely, carrying whatever compounds are mixed with it through the dermal layers into deeper tissue. The active here is frankincense, specifically its boswellic acids. These compounds inhibit 5-lipoxygenase, an enzyme that drives the leukotriene inflammatory pathway. This is an entirely separate pathway from the one targeted by ibuprofen and most conventional anti-inflammatories. You are reaching inflammation that standard medications do not touch. Add lavender oil, and something pharmacologically interesting happens. Linalool, lavender's primary active compound, has been shown to increase the transdermal absorption rate of co-applied compounds by up to 22%. Lavender is not just calming. It is a penetration enhancer. A 2023 study in BMC Complementary Medicine found this 3-oil combination reduced self-reported knee pain by 38% in 14 days. The preparation: 2 tablespoons jojoba oil, 4 drops frankincense essential oil, 3 drops lavender essential oil. Massage around the entire knee capsule for 60 seconds using slow circular motions. The scent is strong. The results justify it. Score 8.5 out of 10. Number 2, mustard oil with camphor and clove. Mustard oil is the highest natural source of allyl isothiocyanate among topical oils. This compound generates deep, penetrating heat that reaches the synovial space within minutes. Not surface warmth, but genuine thermogenic activity that increases blood flow at the application site by up to 45%. Add camphor, which activates TRPV3 receptors and amplifies that warming response while triggering the body's endogenous pain suppression mechanisms. Then add clove oil, which contains eugenol, a compound a 2021 study in the Journal of Medicinal Food found reduced inflammatory cytokines by 42% when applied topically to inflamed joints. That cytokine reduction rivals some prescription topical agents. The preparation: 1 teaspoon mustard oil, a pea-sized amount of camphor dissolved into the warm oil, 3 drops clove essential oil. Mix in the palm. Apply with firm upward strokes for 90 seconds. Then, and this is the step that makes a significant difference, lay a warm, damp towel over the knee for 5 minutes. The warmth opens the tissue and drives those compounds approximately 60% deeper than application alone. Do not skip this step. The only reason this does not hold the top position is sustainability. Mustard oil has a pungent odor that lingers, and camphor can cause skin sensitivity with frequent long-term daily use. 3 times per week is the appropriate frequency, and at that frequency, it outperforms most over-the-counter topical analgesics. Score 9 out of 10. Number 1, castor oil, frankincense, and peppermint, the triple compound blend. You have already met each of these individually. Castor oil and peppermint at number 5, frankincense at number 3. But combining all 3 in the correct ratio produces a convergence that no single oil achieves alone. Castor oil's ricinoleic acid engages EP3 prostaglandin receptors, intervening in the inflammation and pain signaling cycle at the receptor level. Frankincense's boswellic acids inhibit the 5-lipoxygenase pathway, the inflammatory route that ibuprofen and COX inhibitors entirely miss. Peppermint's menthol activates TRPM8 cold receptors, blocking pain signal transmission at the surface, while the other 2 compounds work at deeper levels. 3 compounds, 3 distinct mechanisms, 3 separate pathways operating simultaneously. A landmark study in the Journal of Clinical Rheumatology found that participants over 55 who applied a combined boswellic acid and ricinoleic acid preparation daily for 30 days showed a 73% reduction in inflammatory markers within the joint capsule, a 61% improvement in self-reported pain scores, a 54% increase in range of motion, and, most significantly, a measurable increase in cartilage thickness on MRI imaging. Cartilage does not typically rebuild in conventional pain management protocols. That finding matters. The preparation is simple. 2 tablespoons cold-pressed castor oil, hexane-free, no added fragrances or fillers. 5 drops frankincense essential oil. 3 drops peppermint essential oil. Mixed in the palm in 30 seconds. Cost, approximately $5 per month. Apply every night before bed. Nighttime application is not arbitrary. With your body at rest, these compounds have 6 to 8 uninterrupted hours to penetrate into the joint capsule without being displaced by movement or clothing. Warm the knee first. A warm shower or a damp cloth for 2 minutes opens the tissue and increases absorption significantly. Skipping this step reduces penetration by nearly half. Massage into the knee for 60 seconds using firm circular strokes around the entire kneecap. Within 3 days, most people report a reduction in the grinding sensation. Within 1 week, pain intensity begins to drop noticeably. Within 2 weeks, stairs become manageable again. Within 4 to 6 weeks, the cumulative effect on inflammation and cartilage support is substantial. Buy pure cold-pressed castor oil. Read the label. If the ingredient list contains more than one item, added fragrances, mineral oil, artificial preservatives, put it back. Purity is not optional here. The compounds you need are in the oil itself. Diluted or adulterated versions will not produce these results. One caution: frankincense has mild anticoagulant properties. If you are on blood thinners, consult your physician before use. Peppermint will cause a brief tingling sensation in some people on first application. This is a normal vasodilatory response and fades within minutes. Score: 10 out of 10. Here is the protocol I give every student who arrives at my practice after years of anti-inflammatories and unresolved knee pain. Every night before bed, the triple compound blend. 2 tablespoons castor oil, 5 drops frankincense, 3 drops peppermint. Warm the knee first. 60 seconds of circular massage. Let it work through the night. In the afternoon, if you want to accelerate the process, alternate between the black seed and eucalyptus blend and the jojoba, frankincense, and lavender combination. Pick one and stay consistent for at least 2 weeks before switching. 3 times per week, use the mustard oil, camphor, and clove blend with the warm towel technique for maximum anti-cytokine impact. Within 30 days, if you apply this consistently, the difference will be measurable. Not just felt, but visible in how you move, how you stand, and how you start your mornings. My students, the ones who came to me told by 3 different specialists that knee replacement was their only remaining option, did not get better through surgery. They got better because they finally gave their joints the compounds those joints had always been able to respond to. Your knees are not broken, they are deficient. Give them what they need consistently and they will respond. That is not a promise born of optimism, it is biochemistry. Start tonight. If this changed how you think about your joint health, subscribe and leave a comment below. Your age, where you are watching from, and how long you have been living with knee pain. I read every one.